Burchett is back with us again on Last Week on Earth, the podcast that I wish had a different name during these troubled times. Thanks for joining us, Doc.
I don't know. I think it might be the right name for the right time. Good to see you.
Thank you for being here. So last time we talked, quarantine had just begun for everybody.
Mm-hmm.
We were just being locked down, and I don't know that anybody was taking it as seriously as it needs to be taken, and we're living in a different world now. It's now been basically 3 weeks locked down across the entire planet. And so what's changed? Where are we at? Please fill us in on everything.
God, I mean, I think exactly what you said. Everybody's taking this more seriously, and since then, very sadly, we've seen, mainly in New York and New Jersey, it's real. You know, people are dying. To be frank, hospitals are really starting to get overloaded. They're starting to build extra hospitals in convention centers, calling for a draft of doctors and nurses. It's getting real. But on the other hand, what's good for California, we haven't blown up like that, which has been really interesting. I brought you some numbers that I want to take a look at some point in this to kind of give you more numbers on exactly what we're seeing and talk about.
You want to hop into it right now? Let's hop into those right now.
Let's do it. So the first one I've got for you, it's from worldometers.info. I'll be honest, that thing is not the most reliable sounding thing. But when I looked at these numbers and crossed them with the CDC and other stuff, they're pretty on. 300, and this is as of today. What is today? April 4th. 336,000 in the United States with about 9,600 deaths. But what I really want to focus on there, down below, and anybody can get on this thing, worldometers.info, they update it daily. Down below, when you look at it at the breakdown by state, number one is obviously New York, 123,000. New Jersey, 37,000 is number two. You put those two together, and that almost accounts for half of our cases in the country, which is remarkable that really is a nidus. You know, it really is where the epicenter of this thing is, not only in our country, but in the world right now. But what I want you to note, especially for us in California, California is number 4, only 15,000 cases. New York, New Jersey combined have 10 times what we have in California, which is surprising to me. I mean, I don't know what your thoughts on this, but I thought, this thing first started in Washington State, and I thought with China, I thought San Francisco, San Jose, LA would be much earlier of a port to get this and to blow up. So a lot of people are kind of like, well, why is New York blown up as it has?
Is it because 9 million people or however many live within 2 blocks over there?
It's got to be population density. Exactly right. Apartments, sky rises, all of that kind of thing. But I also want to say, and I don't mean to imply New York didn't do the right things, but there's a real telling number here. If you look more at the details on these things, it breaks it down in terms of cases per 1 million population and deaths per 1 million population. Of course, New York and New Jersey are still high. California.
I have to pause for 1 second, Larry. My dog is going crazy. Henry, come here. Come here. Henry, come here. Keep quiet, bud. And just need a pen, Dave. And then just go to a different shot, please, when we come back from this pause. Jeez Louise. Henry, quiet. Are you on a different shot, love? And we're back. Go ahead.
So I want to point out this: when you break these cases down by how many people are in the state per million population, New York 6,000 per million, New Jersey 4,000, California is only 384 per million. Even when you look at Michigan, Louisiana, Massachusetts, Florida, all of those other guys are at least double of California.
So does that mean we're doing the best job of getting the messaging across?
I think there's a lot of factors. I'm not going to pretend like I know. I think social distancing and everybody staying at home, I think people in California have listened. I think the governor acted early enough. I think sun and the UV may make a difference. This is a warmer climate. But this is a really remarkable difference. So one of the questions you were asking me, can we get out now? Can we do whatever? I think now's the time to double down and to stay on this. I think we have done good as a state. I would encourage people to keep it up. I know it's hard. I know it's hard.
We also have the smallest deaths per million, which is, good news for California, second to Texas only. And people are probably still mostly shooting themselves there. That's the main way they're getting killed over there. So they love their guns. You got to love them for that. They're one place that's really keeping this gun-loving vibe alive. So, that's a question that I had. I had thought that perhaps, and I asked on my social media, and people went crazy, and I did it largely to spark this conversation because I don't think the messaging is coming across very accurately. I don't think people are really understanding why they have to stay at home, why they can't just stay 6 feet away, why anything they touch could end up killing an old person. So if you could explain that, because we were wondering, if we're quarantined for more than 14 days and then our parents are quarantined more than 14 days, can't we visit each other? And people were going nuts saying, no, you can't, because even just walking through the air to get into their house or vice versa, this thing, it's shown in certain tests, it is airborne. It can stay airborne for a few hours. You could walk through a cloud with these droplets and be infected just right as you walk into your parents' house and not even know it, and then give it to them. And so what's your thought on that? Even if two groups are quarantined, do you agree that it's still not safe to do?
I mean, there's a lot of questions in there. This airborne thing, to me, this seems to be one of these, theoretically you can find it airborne. I don't think we should think about this as being paranoid to breathe air everywhere. It's not floating everywhere. The main way that this thing is transmitted is still close contact, which if you look at the way Asia, Singapore, these guys defined it, it was within 6 feet with somebody that had it for 15 to 30 minutes. Just passing by is really not a significant close contact. You think about these people on cruise ships and things like that. When you go to a concert and that kind of stuff, that's close contact. Those are high risk ways of how that stuff's going to go back and forth. Coughing, sneezing. They did a study in San Francisco on the virus that they got, and they found that 50% of the cases came from outside the state, meaning Washington, China. But this is almost equally disturbing. 20 or 30% of them came from healthcare workers. So either the healthcare workers brought it home to their family, and then from there their family spread it out, or these are people that went in and got checked in an ER or whatever. And so, when talking about, if everybody stayed at home at once, couldn't we all just go out then later? But there's still going to be virus circulating. I mean, if you think about it, you got the grocery store people. Think of all these essential folks who are still working and doing a good job that unfortunately it's hard to not be exposed. I mean, you've seen these, I don't know if you've seen these at your grocery store, these glass barriers now between the cashier and the person. There's no way to shut it down. I
shop in a very bad neighborhood. They always have that up there.
Mine is not the same, and it's new. And my cashier person is all freaked out now.
Of course, and they should be getting hazard pay, and they should be getting tipped by people, the delivery people. We watched the video. I understand there was even some correction from the white bearded guy the doctor that showed how to decontaminate your food, disinfect your food by dividing a line on your table and having stuff before you clean it, and then have a Lysol drenched rag, and then clean every item of food before you put it onto the clean side. We've been doing that. We've been cleaning all of our food items outside the house before bringing it inside.
Wow.
To make sure that we're not having any chance to bring food inside. From the one market trip that I went on when I think I actually got the coronavirus. And I'm luckily over the hump of that now, being a few weeks having passed. My sense of smell just returned. So I've got a lemon here.
Really? I didn't know that you got it. What was your exposure? What were your symptoms like?
So I was pretty darn sick for a couple weeks. I had extreme body aches all over.
Yeah.
Just pain in my back and my legs and my arms. Some degree of fatigue, not extreme, but sometimes I would do my social distancing, social club show for just 90 minutes I would end and I felt like I just ran a marathon. Like I felt very tired.
Yeah.
I had a mild cough, just a few coughs a day, luckily, but
Yeah.
kind of an underlying wheeziness that was always there. And I had runny nose, sore throat, and stuffy nose. And then I literally lost my sense of smell for a week and a half. I could not smell anything.
That's funky, isn't it?
Very weird experience. Yeah, although it made the not showering definitely better for me personally. No comments about how it affected my girlfriend.
So, I mean, I would point out, you know, the symptoms that you're talking about are not the classic fever and cough that was.
I did not have fever.
Yeah, that we were first. I mean, you had a little cough, but it didn't seem like that was prominent. Like the body aches were kind of more for you. That's common. Some people even have abdominal pain, diarrhea, vomiting. We kind of found out that, you know, what it is, you know, more than just that.
So do you think I had it based on those symptoms?
You could, and I was just going to bring it. It's possible. It's a maybe, and the only way we would really know is if you had a test. So there's two tests, right? There's the one where they swab you, and you get an answer of positive right now or not, meaning it detects the virus in the swab or not.
And I love people shoving stuff up my nose usually, so I'm anxious. I was anxious to get a test, but I couldn't get one. What's version 2?
I'd be glad to take care of that for you anytime.
It's really nice of you.
The opportunity to. The other test is a blood test that demonstrates immunity. So if you get
antibodies,
exactly, if you get the virus, your body creates antibodies, and now they've got a good test that specifically detects the corona antibody. Now imagine, Ben Gleib, if you got the antibody test, you could basically walk around with a piece of paper and say, I am immune, which means a couple things. You're not going to get sick, and you're not going to give it to anybody, even more importantly. In other words, you would be free. I'm convinced this is one of the ways that the country is going to open up, is that antibody test becomes widespread so that the people who have had it, cleared it, and been okay, they can re-enter society.
So then that brings up a very interesting question. A close friend of mine who has children said to me that they're actually not really trying to not get it anymore. They're not being reckless, but they're not being over worrying about it anymore. Specifically because, and even though one of his kids, this is crazy about where we are in our country about preparedness, is a bit immunocompromised, specifically with lung issues, and he he's not afraid of getting it because he wants to actually get it over with. He says, look, with it coming, and then maybe it'll go away and it'll come back again. And his kids, due to circumstances that are really beyond his control, his kids are being put into a daycare because, and so he's just sure that they're being exposed to it or will be soon. And he doesn't want him and his family to get this once the hospitals are overrun and there are no ventilators and there isn't as good of care available and they're rationing care. Is this an insane idea or is it a very smart idea?
I think it's not insane. You listen to these estimates and people say anywhere from 30, 40, 50, 70%. Some people say we're all going to get it. It's just a matter of time and flattening the curve so we don't run out of vents. So there is a logic to saying, gosh, I just want to get it, especially if you're young and healthy, get over it, and then I can be immune and go from there. Now, if that were my kid, I wouldn't rush to get it if they're immunocompromised and have lung issues. If there's a chance you can get by and not give it to the child, I would probably try to do that. Although this is not a terribly fatal pediatric infectious disease. It just doesn't kill kids very much. Flu kills kids more than this does. So it's not crazy. I don't think it's crazy.
Interesting. So you're on the front lines. You were in the ER just a week ago. Have you seen people coming in with COVID-19? What's the vibe like, and how are you keeping yourselves safe? How's the PPE situation over there?
Yeah, so I work in rural hospitals in California, all over California, and the answer is no. We're not seeing it yet. We see people that come in that are worried they may have it, and most of them are there. They're not super sick. They don't need to be admitted, but they're there because they want the test, because they want to know, can I go back to the work meeting? that we're still having because I don't want to give it to the old guys. Can I go see my mom who's 90? I don't want to give it to her. They're being responsible, and they
Right.
don't want to, be contagious. The
And you
problem,
have tests?
yeah. So there are tests. There's two in one of the places I work. There's two tests. One of them is run by public health. I have to call public health. Now they're answering the phones. They weren't before, and I have to say, "Hey, I got this patient. We have to talk about it." Those tests. The good thing about them are they turn around in a day. So you get a result in about a day. But the problem is they reserve them for people that are sick enough to be in the hospital or people who have the potential to expose it to a large group of people like nursing homes, prisons, whatever. You want to know if those guys have it or not. But if it's the average person who's like going back to their home quarantine, public health won't allow that 24-hour test because they don't have enough. We're still stuck with not enough tests. So they get a test. They do have a test, but it's about a 1 week turnaround. Now, one place that I'm working, they are doing these drive-up tests, and the result for those may be 2 or 3 days, but it still could take up to a week. So testing isn't perfect.
And so another question related to that, and on PPE, you guys are okay because you're in more rural areas?
Well, right now it's okay, but there's still this overall strategy to conserve it, because what happens if we surge? Let me give you one example, because I was just so fired up about the PPE thing. I was like, this is ridiculous. We don't have enough. And then I watched one patient come in. We put him in room 3, the isolation room. I went in with the nurse. That was one set of PPE, mask, face shield, gloves, the yellow gown for me and the nurse. And then we did a whole bunch of stuff for the patient, right? So the person that drew their lab, they had to put it on. And then the x-ray person had to put it on. And then if they would have got respiratory therapy, they would have had to put it on. And then every time the nurse goes back in to give another, so like you can see
a whole
how,
nother set each time.
Well, no, you can sit. Each person gets a new set. We've been saving them, and for one patient, the nurse will re-wear the same one over and over.
Wow, not ideal.
But you can see how, and that's just one ER visit. Imagine if somebody's admitted to the hospital, and they have all kinds of, maybe they have a cardiologist and a lung specialist and an infectious disease, and just like you can just see how we can burn through this PPE really quickly.
Right.
Now, I'm not saying you don't I don't want to stand. I'm going to stand with my brothers and sisters on the front line and say, hey, we really need to be protected. But when I saw that, I was like, God, we're burning through this stuff,
But so when Trump accuses the New York hospitals of somehow stealing or hiding PPE, and he's like, look, there's 300,000 of them. A lot of people are saying there's 300,000 going in, and then I don't know if they're going out the back door. Some people think they're going out the back door. You should investigate it as journalists. He's just not doing the basic math that if you have like 300 patients in a day and you're having to use multiple sets per patient and they're there for several days, the shit just burns through. You get into the hundreds of thousands very quickly.
I think we're just using it. I mean, sure, people might be swiping them, but I think we're using them. Let me give you one example. I think it's important for us to advocate for ourselves and always be safe. But let me give you an example of a really smart way that they improved on this situation. So normally, if a nurse has to give medication, they go into the room and they give it at the bedside. And there's a little pump, an IV pump. Let's say they load the antibiotic, azithromycin. The machine pumps it into the IV right at the patient bedside. To do that, the nurse has to go into the room, put the gown on, potentially be exposed. And so at this one Kaiser hospital, I don't often say good things about Kaiser, but this was a really good thing that they thought of. And really, it's the nursing, too. Instead of having the pump right at the patient bedside where they have to go in and do that, they had it outside the room. There's no reason they need to go in there, and they just used a longer tube. I was like, that's brilliant. It saves PPE. It saves a nurse exposure. Now, it does suck. The patient becomes more isolated, and that is harder for patients to be in the hospital and like not even get the human touch of a hand on the shoulder. And it is harder for that, but I liked that workaround.
I've seen even healthcare workers now. I saw something online that because they're wearing these face shields and they're all gowned up and you can't really even see their face well, they're wearing a picture of themselves smiling on the outside of their yellow gown just to humanize it and show them there's a person behind there helping you and it's not some scary medical entity.
Yeah, some scary Martian from Back to the Future, that scene where he looks like whatever. In the profession, we have a sense...
Trying to scare the mom from... Or trying to scare him from taking his mom out to the dance. It was a very weird, incestuous subplot that didn't need to be in Back to the Future, and we can all agree on that.
Oh, I do love that movie, and I still love it.
Good movie. Do you ever put on the yellow and look in the mirror and think, I should go cook meth in this? This is a very meth cooking, Breaking Bad type outfit.
No, I did take a couple pictures in the yellow stuff the other day, just to document.
Can you send me one so I can show the audience?
Yeah, I'll send you one. It's a pain. I mean, to be honest, it's a pain in the butt to get in and out of that stuff. Donning and doffing, they call that. I have no idea.
I'm not going to call it. That's very stupid sounding. But so you seemed a little bit. My last question for you is: you seemed a little bit surprised when I said how seriously my girlfriend and I are taking the decontaminating of the food before bringing it in the house. Shouldn't we all be doing that? I mean, that's the way people are getting sick. I'm hearing stories of people that are getting sick even though they've been quarantined and have only been doing delivery, so it's clearly coming in just through packages.
Well, if you've already had it, what's it matter?
Well, because we don't know. You said it might be, it might not be.
Yeah, I think it's still good. Oh, I'm running out of battery on this thing. I may die on you.
It's okay. We're about done. So
the other thing, let me just show you this. This is the other one.
Don't die on me. We need you on the front line.
I know. Well, the computer's going to die on you.
The computer.
Let me just say this. You can look up your county public health website and see how much corona is in your town.
How do they look that up?
Type in public health and then whatever your county is, and the county public health will list it. Los Angeles County, 594, about 6,000 cases, 132 deaths. That's about half of California.
We're doing pretty good. I'm losing you. I just lost the audio. Thank you, Doc. Great to see you again. Appreciate you being with us.
Thank you, Ben Gleibs.
So there you have it.